Hello, family. It is a long time that I've been with you, and today I'm so happy once again to discuss a very simple topic with you. As a result of the numerous questions that is being posed to me whenever clients come to me, one of the questions that most of my clients ask me is, okay, so in the journey of fertility, in the journey of seeking a child, okay, when should IUI be considered? That is intrauterine insemination be considered? When should IVF, in vitro fertilization, be considered? Okay, or when should nothing at all be done? So today, this is what I'm going to do. We are going to talk about when should or no, who should consider IUI? Who should consider IUI, or when should IUI actually be considered? Let me just give a very simple definition about IUI. Okay, IUI simply means that the sperm is washed and then concentrated. Okay, and then the concentrated sperm, through the help of some insemination devices, we're able to push the sperm close into the uterus, close to the egg. Okay, so that to increase the chance of success. All right. So the purpose of IUI, intrauterine insemination, is to ensure that the sperm is closer to the egg, so that fertility can actually go on. So you agree with me that your basic biology, whenever the woman is ovulating, that's what we call the woman is producing egg. Okay, is ovulating. When you have sex, the sperm have to travel through the vagina into the cervix. That's the tip of the womb. It's called the cervix, and then go into the uterus to meet up with the egg. So in IUI, what that we are doing is that we are cutting short the journey of the sperms. So we are helping the sperm to get to the womb or close to the egg as early as possible without a hassle. That is all about IUI. Okay, I hope you understand. Who are the ideal candidates for IUI? One of the ideal candidates of IUI is women who have ovulation problem, that you don't have a hormonal imbalance or irregular menstrual cycle. If you fall within this category, it is important that you may like to consider IUI. Because when it comes to IUI, because you're having hormonal imbalance, what it may mean that you may having issues with ovulation, or you may having issues with producing egg. Okay, in layman's language. So we are going to help you with some level of injection to help you to produce egg, not only to produce egg, to be able to produce quality egg. Believe you me, some ladies can have their menses, but they don't produce egg at all, and ovulation. Okay, so the fact that you have your menses does not mean that you are producing egg. So another candidate who are ideal for IUI is candidate couples or male who have low sperm count. Okay, specifically who have issue with motility. When we talk about motility, the movement of the sperm. Okay, and let's take this way: they have low sperm count. The low sperm count is not that severe. They have some good amount of sperms. All right, one. And two, or the movement of the sperm is not enough. Such a person is an ideal candidate. Listen, get this just right. If the sperm is not a lot, okay, or the movement is not so good, once we be able to concentrate the sperms and we're able to pass it into the uterus, okay, close to the egg, what it means is that the distance between the sperm and the egg is short. So if you move the motility, the movement is not good, such a person, IUI can go a long way to be of help to you. Right. So another factor that can also be involved in the whole issue about the candidates who need IUI is people who have unexplained infertility. We have couples out there. Okay, the couple might have gone through every test, every medical test that there is, but there is no evidence of a problem. they've done HSG, they've done the hormones, there's no evidence of any problem. However, they are not conceiving. Such a person, IUI may be helpful to you, okay? It may go a long way to help you. You see, I always say that, look, the fact that we've done all the tests, okay, and it may not be able to identify any problem. Maybe there may be a problem, but the current scientific knowledge we have, okay, or the laboratory investigation we have available in our system now is not able to pick up the problem, okay? So the fact that every test says you are clear may not necessarily mean that you are not clear, okay? Or it may also mean that indeed you are clear and there's no problem. How be it, there's no harm in trying IUI. When you try IUI can have a long way to help both men and female couples with issues of unexplained infertility. Another candidates who I think that are who benefit from IUI are the kind of candidates who have what we call the cervical factor infertility problem. Okay, situation where the mucus, okay, the mucus within the cervix, okay, it can be too thick or the pH can be too high or low, can really cause issues with the sperm. Some people, because when you do the IUI, you bypass this, but you bypass the barrier, the mucosal lining of the cervix. So that alone can also help you to, once you bypass it during IUI, it can help you to get pregnant. So of course, when you have cervical factor infertility, doing IUI can really go a long way to really help the couple. Another factor also for people who will need IUI, very debatable, is that single women, okay, believe you me, we have a lot of women out there or men out there, because of issues of history of with men and women, they've told themselves, I'm not ready to actually get myself engaged with anybody. I'm not ready to have sex. I'm not ready to have any relationship. Okay, if you are such a woman out there or such a man out there, what we can do to you is that they normally get donor sperms or donor egg, and then we are able to do the IUI for them successfully. So these are some of the candidates, or the few candidates that may need IUI. So stay tuned for more information on our next video. Thank you.